Throughout the course of human history, there have been all sorts of strange medical practices that have been used to treat various ailments and injuries. Some were based on superstition and folklore, while others were based on a more scientific understanding of the body. However, despite their strange nature, some of these practices actually worked and are still used today. Let's take a look at a few of these strange medical practices that actually worked. Bloodletting, also known as bloodletting, is one of the oldest forms of medical treatment in history. The practice of removing blood from the body to cure or prevent illness dates back to ancient Egypt, where it was first recorded in 1550 BC. The idea behind bloodletting was that by removing the bad or unhealthy blood from the body, you could restore balance and promote healing. This was done through methods such as leeching, where leeches were used to suck the blood out of the body, or lancing, where a small incision was made in the skin to allow the blood to flow out. Even during the Middle Ages, bloodletting remained a common practice, used to treat everything from headaches and fever to more serious conditions like epilepsy and even mental illness. But why did this seemingly barbaric practice actually work? Well, the answer lies in the fact that many illnesses are caused by an imbalance of the four humors, which were believed to be the four essential elements that make up the human body. These are phlegm, yellow and black bile, and blood. By removing the excess blood from the body, the theory went that the remaining three humors could be brought back into balance, restoring health and well-being. While the practice of balancing the four humors may seem outdated and even absurd today, the underlying principle of treating illness by targeting its root cause still holds true in modern medicine. In fact, many modern treatments, such as chemotherapy and radiation therapy, are designed to do just that, to target the root cause of the illness, in this case, cancer cells. So while bloodletting may no longer be a common practice, the idea behind it still has relevance in the modern world. Trepanation, the process of drilling a hole into the skull, is another example of a strange medical procedure that has been around for thousands of years. Evidence of trepanation has been found in the archaeological record dating back as far as 7000 BC, with the oldest known case being the discovery of a human skull with a hole drilled into it found in France. During the Neolithic period, it was commonly believed that the process of trepanation could help to relieve pain and pressure in the head and was used to treat conditions such as headaches and even epilepsy. In ancient Egypt, trepanation was performed as part of a surgical procedure to remove brain tumors. The Egyptians kept detailed records of the procedure and even developed specialized tools for the process. One of the most famous examples of Egyptian trepanation is the case of a patient named Isis, who underwent the procedure in 2680 BC to remove a benign brain tumor. Despite the primitive conditions, the surgery was successful, and Isis made a full recovery. Although trepanation fell out of favor in later centuries, it made a comeback in the 19th century when it was rediscovered by European surgeons. Today, trepanation is still used in modern medicine, but only in very rare cases and with advanced technology. For example, in cases of severe traumatic brain injury, doctors may need to drill a hole into the skull to relieve pressure on the brain. In other cases, such as with certain types of brain tumors, trepanation may be used in combination with other surgical techniques to remove the tumor. Overall, trepanation remains a powerful testament to the evolution of medical science and the incredible advancements we have made in our understanding of the human body. The doodling technique is a form of alternative medicine that has gained popularity in recent years. It involves placing a small glass or metal object, such as a marble or bead, under the tip of the tongue and then moving it around in a circular motion. Proponents of the technique claim that it can help with a variety of health problems, including stress, anxiety, depression, speech disorders, and even ADHD. But does the daddling technique really work? The answer is surprisingly yes. A study published in the Journal of Alternative and Complementary Medicine found that participants who practiced the technique for just 5 minutes a day for 8 weeks experienced a significant reduction in stress levels. Another study published in the International Journal of Environmental Research and Public Health found that children with speech disorders who practiced the doodling technique for 30 minutes a day showed improvements in their articulation and fluency. The exact mechanism by which doodling works is not yet fully understood, but it is thought to stimulate the nerves in the mouth and throat, which then sends signals to the brain that promote relaxation and focus. Doodling can also help to activate the parasympathetic nervous system, which is responsible for calming the body down. Whether you are looking to reduce stress and anxiety or improve your focus and concentration, the doodling technique may be worth giving a try. Just remember to use a smooth, rounded object and start with a slow circular motion under the tip of your tongue. With a little practice, you may soon experience the relaxing and focusing benefits of this ancient technique. Arm amputation was a common practice in the early days of modern medicine, often performed to treat gunshot wounds or severe infections. It wasn't until the mid-19th century that scientists began to understand the importance of proper wound care and how to prevent infection. In 1867, a British surgeon named Joseph Lister revolutionized the field of surgery by introducing antiseptic techniques. He understood that if the area around the wound was kept clean, the chances of infection and subsequent amputation were greatly reduced. Lister's methods became widely adopted, leading to a significant decline in amputations being necessary. Today, thanks to modern antibiotics and surgical techniques, amputations are rarely ever needed due to gunshot wounds or infections. Instead, surgeons can now close wounds and treat infections without resorting to such drastic measures. Even in cases where amputation is absolutely necessary, such as with gangrenous tissue, new techniques such as replantation and microsurgery have allowed patients to regain function in their limbs. Thanks to these advancements, many people who would have lost a limb in the past can now live full and active lives with their limbs intact. Shock therapy is a medical procedure that has been used since the 19th century to treat a variety of mental disorders, including schizophrenia, bipolar disorder, and major depressive disorder. The goal of electroconvulsive therapy is to induce a brief but intense seizure in order to reset the brain's electrical activity and alleviate symptoms of these disorders. It might sound scary, but studies show that ECT is safe and effective for many people who don't respond to medication. In fact, it has an 80% success rate for treating severe depression. The procedure is typically used as a last resort when other treatment options have failed and is administered by qualified medical professionals. Despite its effectiveness, shock therapy has a reputation for being a brutal and inhumane procedure. This is largely due to how it was portrayed in the media in the mid-20th century, often showing patients being subjected to the procedure without anesthesia or proper safeguards. However, this is not how ECT is performed today. Modern-day shock therapy is always administered with anesthesia and muscle relaxants to minimize discomfort and prevent injury. So if you or someone you know is struggling with a severe mental illness and hasn't responded to traditional treatments, don't hesitate to talk to a medical professional about whether ECT might be a good option. From ancient Egyptian brain surgery to the modern-day applications of electroshock therapy, the history of medicine is filled with strange and surprising procedures that have been used to treat illness and injury. While some of these practices may seem barbaric or outdated today, many were actually ahead of their time and had genuine benefits for those who received them. We can learn a lot from the medical pioneers of the past and the strange and innovative procedures they developed. And who knows what the future may hold for the field of medicine? Maybe one day we will look back at some of today's most common treatments and wonder why we ever did them in the first place.